Very good afternoon, all the students. Can you update? Is the audio video fine? Can we start with the session? Yes, can you update? Is the audio video fine? We start with the from this session of INICET, especially for INICET for the next upcoming INICET. I will be trying my best in next couple of minutes. I'll be giving you all the important topics. Is audio video fine? Can you update in the chat box? Very good afternoon, all the students. Thanks for updating in the chat box. So, myself, Dr. Deepak, will be taking this session in next couple of minutes. I'll be trying my best to give you all the important topics for upcoming INICET examination. So, any query, any point you want to ask, you can just interact with me in the chat box. So, let us start with this interactive session. Yes. Is audio video fine? Yes, absolutely. Now let us start. But I hope everybody is comfortable on the other side. And for the last 2-3 days, once this declaration is there of upcoming NEET examination, but I take my word, never panic. This now the upcoming examination is a game of mental game. If the students who will lose the confidence, who will panic in the upcoming days, will be losing the game of NEET 2022. Am I understandable? Are you getting this point? So now whatever the time we are having, will be giving our best performance. We always believe, okay, if we have the option to choose, we should choose the best option. But if you are not having any option, we have to give our best. Am I understandable? I hope you are getting my message. At this point, we are not having any option except giving our best. Am I understandable? Last NEET examination have given a strong message to everyone that there is no shortcut to success. It is not possible that we will mug up the MCQs and we will get rank in all India. Forget. We have to go for gold standard class notes. We have to revise them again and again. And in the last few days before this, now let us make a plan of action. Upcoming INICET examination, if I am fully prepared, I will give my best. I will try to get rank in the upcoming INICET examination. But even if I'm not prepared, I will try my best to take this INICET examination as a NEET mock examination. I'm understandable, and upcoming each and every day is very crucial. Each and every day. So let us work 24/7, and our aim of conducting this session is to make you realize कि बेटा concept. Let us start the game of ENT. As for INICET examination, I am expecting 5 to 6 MCQs. I am giving you 2 images. One image, there is a reddish mass in the nasal cavity. This is an endoscopic image of a nasal endoscopy of a 14-year-old boy. Can you make a diagnosis, beta? I'm writing 2 points. One, this image is a image of a 14-year-old boy. Second, there is a unilateral cervical lymphadenopathy in a 65-year-old male. 65-year-old male. Yes, any student who can tell me which are these 2 distinguishing features, these distinguishing images. One image is for Ngo Fibroma and one is for nasopharyngeal carcinoma. 2 important topics for upcoming INICET examination. Ngo Fibroma, which are the important worth remembering points? Very good, very nice. Dr. Aman, it is Ngo Fibroma. Absolutely yes. What is the important option for INICET? Your AIIMS people, they are fond of asking, never take biopsy. This image, when you see this image, it's very temptation to take biopsy from this image, but never ever do this blunder. Ngo Fibroma, we never take any biopsy. Am I understandable? Always remember, glomus tumor angiofibroma, any vascular tumor, hemangiomas, you always avoid biopsy. Which artery is embolized? Internal maxillary artery. Now listen carefully, beta. In NEET examination, they will be asking you which is the most common site and what is the presentation. Epistaxis, most common site is sphenopalatine foramen and symptom is epistaxis. But if you are going for NEET examination, expect INICET. In INICET, in Central Institute, they will be either asking you no biopsy. And which artery we embolize? We embolize internal maxillary artery. In the upcoming NEET examination, I am expecting one is either they will give you either internal maxillary artery or sphenopalatine. Sphenopalatine is for epistaxis, internal maxillary artery. Very good, Dr. Anu Thomas, excellent. It is internal maxillary artery. We give radio. Why we give radiotherapy in angiofibroma? Why we give chemotherapy in angiofibroma? Why we give hormonal therapy? These all are true statements. We give these three to reduce the size of the tumor. Nasopharyngeal carcinoma, they can give you a typical history of Chinese patient, main culprit, Chinese patient, 60-year-old patient, unilateral cervical lymphadenopathy. They can either ask you Trotter's triad, T-R-O-T-T-E-R, Trotter's triad. What is Trotter's triad? Will be your glue ear, along with glue ear, there will be 5th nerve and 10th nerve palsy. 5th nerve, there will be severe pain. 10th nerve, there will be palatal palsy. Just try to learn better. If they are showing you this type of image, it is Trotter's triad. What is the favorite question of Central Institute? They will give you a long history of nasopharyngeal carcinoma and the first option will be nasopharyngectomy is the treatment of choice. Not at all. Nasopharyngeal carcinoma and glottic carcinoma. MCQ for INICET, nasopharyngeal carcinoma, glottic carcinoma. Highly radio sensitive. So what we are doing, we are giving radiotherapy followed by chemotherapy. This is the first segment where I'm giving you 15 to 20 topics from where they will be high probability they will be asking the MCQ. Again, take my word, honestly I'm telling you, this is a platform where we are giving a message how to proceed in the last few days. No panic, relax your mind, no regrets, just revise. Whatever you have learned, revise. Second segment, what we are expecting from INICET, they are asking X-ray views. No doubt nowadays we are relying more on HRCT or we do diagnostic endoscopy. Always remember, paranasal sinus investigation of choice will be HRCT and diagnostic endoscopy. Am I understandable? If they use the word radiology, so I will be going for radiological investigation of choice. That will be your HRCT, but overall it is diagnostic endoscopy. Endoscopy is always better. You are seeing something, everything will be in front of you. So diagnostic endoscopy. But I don't know why your Central Institute, they are asking X-rays for the last few sessions. So they can ask you this: Waters view is a broad face, and if they show you this type of long face, that will be your Caldwell's view. So Waters and Caldwell's, these are 2 points they will highlight. They will ask you to identify, or they can ask you which sinus is not visible on Waters view, will be not getting posterior ethmoid. And for sphenoid, I have to ask the patient to open the mouth. That is known as Pierce view. I hope everything is on your tips. One of the student is asking which is more reliable answer. Dr. Suda, they will not give you both the option, radio plus radio, second option chemo. If they give, go for radio. If they give, go for radio. But what we follow, radiotherapy followed by chemotherapy in nasopharyngeal carcinoma. Very good. Dr. Posterior ethmoid is not visible. Caldwell's view is for ethmoid and frontal. So this is the second area where I am expecting MCQ in Central Institute. Now, what is this one? This is I'm giving you 3 keywords. Jumping on the keywords in Central Institute, focus more on the keywords. They are giving a age between 5 to 20 years. They are giving a bilateral pathology. Patient is having some ear obstruction. There is some obstruction in the external auditory canal. Anyone? 5 to 20 years is a bilateral condition. What is this? Any student? Or what is this? Bilateral external auditory canal. There is a squamous debris. In INICET, they will be using a word keratin plug. Beta, inverted commas, keratin plug. If used in the MCQ, I will be going for Keratosis obturans. Dr. Dinesh, excellent, beta, excellent. Keratosis obturans. Everybody is giving the right answer, but the time-bound game. But is a time-bound game like upcoming NEET examination? A few months are left. Take my word, the game is of quality, not quantity. If you give me opportunity, I can teach you keratosis obturans for minimum 3 hours, but we have to complete in 1 minute. So which are the worth remembering point? 5 to 20 years, bilateral, external auditory canal, all the books mentioned. There is no chance of necrosis. If you get necrosis, listen carefully everybody, if you get necrosis, there is a high probability of cholestoma formation. Exceptions always there, but commonly in keratosis obturans we are not getting necrosis. But if a COVID patient comes to you, a COVID history, COVID patient, COVID positive with squamous debris in the external auditory canal, keratosis obturans, age of distribution 5 to 20 years, we can get the evidence of necrosis. Just remember this point. In which clinical scenario you can get necrosis in keratosis obturans? Again, one of the favorite topic of your Central Institute will be getting COVID positive patient. They can ask you 2 MCQs in ENT. Most common ENT manifestation of COVID, that is your sore throat. Always remember, most common ENT manifestation, sore throat. Non-ENT manifestation is your fever. 2 important MCQs for upcoming examination. Most common ENT manifestation of COVID, that is your sore throat, and most common non-ENT will be going in the favor of fever. What is this I am showing you? Again, something to relate with COVID patient. This blackening on the nose. What is this? Mucomycosis. Yes, you tell me why the patient have necrosis. Why? Because this patient this is having special love. Mucor is having special love for blood vessels, special love for blood vessel. It is not anosmia, Dr. Anu Thomas. This is not anosmia. It is sore throat, most common ENT manifestation. Blood vessel, special love for the blood vessel. Always remember. Therefore, what are the worth remembering points? Central Institute. What AIIMS people will do? They will write one statement. Patient will have severe epistaxis. No bleeding. Why no bleeding? Everything is necrosed. Everything is infected. Is having a special love for blood vessel. So it will be no bleeding. There will be severe pain. Absolutely false statement. Anesthesia over the face. Anesthesia over the face. 2 key points for mucomycosis. No bleeding, always remember, no bleeding, special love for blood vessel, anesthesia over the face, drug of choice liposomal amphotericin B. If I'm giving you 1 minute, mucomycosis 5 points, special love for blood vessels, no bleeding, anesthesia over the face, liposomal amphotericin B, and diabetic patient. In ENT, diabetic patient can be either your mucomycosis or malignant otitis externa. So if I show you the same lesion on the external auditory canal, it becomes malignant otitis externa. Worth remembering point, technetium 99 scan is for diagnosis, gallium scan is for prognosis. But AIIMS people, what they will ask you, which lab investigation we use? Anybody? We use ESR. NEET people will ask you after how many weeks ESR comes down. It is 2 weeks ESR comes down. So malignant otitis externa, technetium 99 diagnosis, gallium scan prognosis. Next 40-45 minutes will give you a message how we have to run in a fast mode. Am I understandable? This is not the time to relax and read in a slow manner. Mucomycosis, 1 minute, it should be revised. It will be only possible when you will concise all the topics. Just make a rule that whatever you are reading, you concise at the end of the day, so you can revise next time in a nice way. What are these 3 clinical images showing you? So the first image is giving me a keyword. Which keyword? Sir, upper part of the tympanic membrane, par flaccida involved. If par flaccida involved, it is going in the favor of atticoantral disease. I hope you are getting the concept. Everybody giving nice reply in the chat box. Very good. With the ice cone appearance, where is ice cone appearance? Ice cone appearance will be in acoustic neuromas. No? Acoustic neuroma. This is atticoantral ear. Very simple. Atticoantral ear. You will be getting which are the important keywords. AIIMS people will give you 1 word out of these 5 words. they will be giving you disease in the attic area, atticoantral, upper part, or they can give you the word foul smelling, or they can give you the word blood stain ear discharge. Attic region, they can give you a word scanty discharge. These are the key words: scanty discharge, foul smelling, blood stain. If there is any polyp in the ear, always remember these are atticoantral ear. And what is the treatment for atticoantral ear? I'm just giving you a brief orientation, but listen carefully. If it is serous otitis media, that is bulging tympanic membrane, no fever, no congestion, serous otitis media, what will be the treatment? I'll be going for myringotomy with grommet. If it is ASOM, acute suppurative otitis media, you will be going for high-grade fever will be there, the keyword, and the treatment will be myringotomy circumferential incision. If it is tubotympanic ear, in which none of these 5 words are there, I'll be going for tubotympanic safe ear, tympanoplasty with OCR, ossicular chain reconstruction. And if these 3 images shown, 5 words given, go for mastodectomy. Which mastodectomy is commonly done? Most common is modified radical mastodectomy. So what is the indication of radical? Only one indication, that is malignancy. That is your malignancy. One MCQ on complication of CSM. Expect beta, one MCQ will be there on complication of CSM. They can either ask you an MCQ on mastocytitis. Why? Because mastocytitis is the most common extracranial. So you should be confident of all the one-liners related with mastocytitis. They can ask you extradural abscess. What is the beauty of extradural abscess? Is a silent complication, or they can ask you temporal lobe abscess. Like in the last NEET, they have given you a CT examination of a temporal bone abscess, because it's the second most common complication after meningitis is your temporal lobe abscess. Or the MCQ favorite question of lateral sinus thrombosis. So all the students who are preparing hard for INICET examination, you should be confident of mastocytitis, extradural abscess, temporal lobe abscess, and 5 findings of lateral sinus thrombosis. Let us revise in a fast mode. Which are the 5 findings? You will be getting edema over mastoid, that is known as Grisinger sign. Edema over the eyes, known as Crowback sign. Press the jugular, no increase in ICT, that is your Tobbe-Ayer sign. Spiky fever, known as picket fence fever. Hectic fever. 4 clinical findings. These are 4 clinical findings. One is radiological finding in lateral sinus thrombosis, that is your empty delta sign. So in the last go, you should revise in a nice way. Very good. Everybody is responding nicely in the chat box. This speed I want you should revise, and take my word, very strong message to everybody: group study. When time is less, like they have announced the NEET examination in the upcoming March, so it is high time is less. We will increase our group members, make a group of 2-3 friends, divide the subjects, discuss in a fast mode. Take my word, group study is the best method to get a good rank in All India AIIMS examination. Are you getting my message? Clear? Coming on the next one, what I am showing you, a reddish mass behind tympanic membrane. If there is a reddish mass behind tympanic membrane, or go for glomus tumor. So what is this diagnosis? Glomus tumor. I will not take any biopsy in this patient. Yes, I will not take any biopsy in the patient. Most common site of glomus tympanum. What is most common site of glomus tympanum? Is promontory. And what is the most common site for glomus jugular? Coming from the floor. All these signs related with glomus jugular, like rising sun sign, brown sign, should be on your tips. Expect one MCQ on glomus tumor. What AIIMS people will ask you, which is not a part of treatment in glomus tumor. Always remember, we never use a drug interferon. There is no role of interferon in glomus tumor. Just remember this point. Clear? One MCQ expect on pure tone audiogram. They can ask you maximum hearing loss at 2000, Carhart notch. And if there is an MCQ in the Carhart notch, autosclerosis. And autosclerosis coming, Carhart notch is in bone conduction. It is in bone conduction. Your NEET people will be more interested in asking Carhart notch, but your AIIMS people will be asking you more they will be more interested in asking the MCQ, okay, what will be there after stapedial. So just remember, otosclerosis, the tympanogram is AS, but after stapes surgery, the graph is AD graph. AIIMS people can ask you cookie bite audiogram. Cookie bite audiogram is a feature of cochlear otosclerosis. I am touching all the important favorite topic of Central Institute, from where they can pick one MCQ. Clear? They can show you tympanograms. All the tympanograms should be on your tips. Before that, before coming on the tympanogram, I just want to highlight one point. They can ask you U-shape audiogram. Beta, U-shape audiogram is congenital deafness. Expected MCQ. Start topic MCQ can be there. Which is the most common cause of congenital deafness? CMV, cytomegalovirus. Listen carefully, beta. Close your eyes, listen the word. Chances of sensory neural deafness. Chances of sensory neural deafness in symptomatic congenital CMV is on the higher side with respect to asymptomatic congenital CMV infection. Is a true statement. Chances of sensory neural deafness in symptomatic congenital CMV is on the higher side with respect to asymptomatic congenital CMV. Is a true statement. Is a true statement. Clear? This question can be repeated in the upcoming INICET examination. Coming on the tympanogram, what I am showing you tympanometry. One MCQ from tympanometry will be there. Why it is important? It is an investigation of choice for conductive deafness. What is the other investigation which we do along with tympanometry is stapedial reflux. Stapedial reflux. They can ask you which is the highest center for stapedial reflux. Anybody? All the students? Very nice response. I appreciate all the damn students or all the medicos attempting in the chat box. Very nice. But this is the best part of live interaction. When you interact, you get motivation from all the other students. Stapedial reflux, superior olivary complex. Always remember, it is superior olivary complex is the highest center for stapedial reflux. Expected MCQ. Tympanogram should be on your tips. If this graph is shown, I am just highlighting this graph. This graph is your A-shaped tympanogram. A-shaped tympanogram. A-shaped tympanogram. This is your flat tympanogram, or B. If A is shifted from the x-axis, we have C tympanogram. We have C tympanogram. They can either ask you AS or they can ask you AD. This is not the time to go in the depth of these graph. At least you should be aware of these basic points. Clear? Then they can show you noise-induced trauma. Very favorite question of Jipmer people. Noise-induced trauma, 4000 Hertz, hearing loss, outer hair cells damage, outer hair cell damage. What is the guideline? Guideline is 85 decibel in WHO, but what we Indian people say it should be 90 decibel. But Jipmer people give you -1 by asking what is the guideline in city life. Anyone who can update? What is the guideline in city life? City life, the guideline is 45 decibel. Beta, -1 millena. 85 is WHO, 90 is Indian Factory Act for noise-induced trauma. Not in city life. City life, it will be 45 decibel. 45 decibel. Then they can show you this investigation. What are these two graphs showing you? I am showing you a rising curve. Yes, rising curve. Graph is going up, means low frequency hearing loss. High frequency hearing loss, presbycusis. Low frequency hearing loss, Meniere's disease. What is the investigation of choice of Meniere's? Electrocochleography. Very good, excellent, beta. It is 45 decibel only. So these two images, I can ask you which disease I am talking about. I am talking about Meniere's, low frequency hearing loss, rising curve, electrocochleography. Out of otosclerosis, Meniere's and acoustic neuroma. One MCQ will be there. In the last, they have asked you, last session they have asked you Antony cell, Antony A, Antony B along with sensory neural deafness. So answer was vestibular schwannomas, acoustic neuroma. This year I am expecting MCQ on Meniere's, so they can ask you MCQ on Meniere's. Always remember, beta, no need of panic. In upcoming days, those students who will panic will lose the game. I mean, your INICET is on 14th November. Your NEET examination is on 12th March. Is for every student. It's not only for you, it's for everyone. So now the game is mental, how mentally you people are strong. So just be confident in the upcoming days if you want a decent rank. And if you ask me, I will take in a positive sense. Okay, less time. Now the game is of more of mental confidence. So we'll be mentally confident and we'll hit the upcoming INICET or NEET with full confidence. And the NEET examination will be very easy to crack. Why? Because the backlog, the good ranks already that taken by the brilliant students. So now the upcoming NEET will be on the easy side. So I should take in a positive sense. Okay, yeah, next NEET I will try. I will give my best. Everybody in the chat box, make a promise. Thumbs up. Yes, we will try our best in the upcoming NEET examination. Just make a promise every day. Every day when you wake up in the morning, just recollect this promise. Okay, yeah, I have promised in the ENT session. Okay, I will give my best in the upcoming days. No negative thought should be there in the upcoming days, because the day you panic, you will lose the whole game. Am I understandable? This treatment for menials is most expected MCQ. You should not ask me, sir, who told you this question will be there, but expected MCQ. This MCQ is expected for upcoming examination. I will waste my crucial time on this table. One MCQ from this table, mandatory. One MCQ from this table, mandatory. Just wait, let me refresh. Yeah, one MCQ from this table, mandatory. Low salt diet, dietary modification. This is the first line of treatment. Just remember this point. Low salt diet, dietary modification is the first line of treatment. PPT, positive pressure therapy, that is known as auditory physiotherapy. 80% of the patient respond. If this patient doesn't respond with the medical treatment, M for menials, M for medical treatment, I have two options. If hearing is my concern, I will go for surgery of choice. What is surgery of choice? Surgery of choice is your endolymphatic sac decompression. And if treatment, just wait, let me refresh. If their examiner is asking you, just wait. If examiner asks you, the treatment of choice will be endolymphatic sac decompression. Endolymphatic sac decompression. Surgery. So surgery of choice will be endolymphatic sac decompression if the examiner asks you surgery of choice. But if our examiner asks you overall treatment of choice is your medical treatment. Just give me 1 second to refresh. Yes. So if patient hearing is concerned, if hearing is the main concern, I always go for endolymphatic sac decompression. If hearing is not the concern, I'll be going for intratympanic injection of gentamicin. 2 expected MCQ. Patient not having the hearing concern, I will be going for intratympanic injection of gentamicin. And if hearing is a concern, I will be going for surgical decompression. Which surgical landmark is used? Donaldson line is used. Always remember. Favorite choice of your AIIMS people, they can either ask you Donaldson line or they can ask you facial recess. Donaldson line is for endolymphatic sac decompression and facial recess is for posterior tympanotomy. Next MCQ, I'm showing you one patient suffering from sensory neural deafness. The slide number 1, I want you should make a diagnosis. Slide number 2, they can either ask you, they can give you a histopath finding, or they can ask you a radiological image, MRI, gadolinium enhanced MRI, on which I'm showing you ice cone appearance. Absolutely yes, the answer will be acoustic neuroma. This vestibular schwannomas, expected MCQ, treatment of choice is surgery. If patient say I'm not interested for surgery, I will be going for gamma knife radiotherapy. I will go for gamma knife radiotherapy. Clear? Gamma knife radiotherapy, Antony A, Antony B cell. What will be the investigation of choice? Will be your brainstem evoke response audiometry, also known as ABR, auditory brainstem response. Let us few MCQs. Which is the largest wave? Fifth wave is the largest wave. Which is the most sensitive wave? First wave is the sensitive wave. First wave is the sensitive wave. Brainstem evoke response audiometry for neural deafness. This should be on your tips. Yeah. Here comes the most important topic for Central Institute, BPPV, benign paroxysmal positional vertigo. Which canal? The word itself is telling you I am posterior canal involved. What is the pathophysiology? There is a loose autoconia. There is loose autoconia made up of calcium carbonate body. The whole cycle is known as APLAS. Beta dhyan se MCQ ko padna, read the MCQ with very peaceful mind, very peaceful mind. If examiner is asking you the diagnostic maneuver will be APLAS will be Hall-Pick. Diagnostic maneuver will be Hall-Pick. What is Hall-Pick? The first three steps of this cycle. Patient sitting, head on one side, supine. This is Hall-Pick. The whole cycle is known as APLAS. That is a treatment. So examiner will give you a long history. What is the favorite question of examiner? Is a benign vertigo. Very short duration, like few seconds, patient will be having vertigo. It will not be for 2-3 hours beta. One statement will be given, it is for 2-3 hours, not practically possible. Is it possible I am getting vertigo in one position, I will remain in that position for 2 hours? Not at all. What I am showing you, again, very favorite topic of Central Institute. For the last 3 years they are asking this question in every Central Institute. Yes, what I am showing you, I am showing you a semicircular canal. On the roof of the semicircular canal, there is a dehiscence fistula. There is a damage. It can be traumatic. It can be as a result of complication. CSM. What is this one? Superior semicircular canal dehiscence syndrome. Most common canal involved in BPV will be posterior. In semicircular canal will be your superior. The word itself is telling you on the roof of the superior canal there is a dehiscence. One point which they are asking for the last 3 years is having sensory neural deafness false statement. You will be having conductive deafness with neurological symptoms. Why neurological symptom? Because unwanted stimulation is going to the brain. So conduct. What is the treatment? Wait and watch. If patient is not responding, will be going for surgical repair. So superior semicircular canal dehiscence syndrome. Just remember conductive deafness. Beta kuch aur yaad rahe na rahe. Superior semicircular canal dehiscence syndrome. What is this? I am showing you vestibular evoke myogenic potential. Investigation of superior semicircular canal dehiscence syndrome. What we see on VEMP, vestibular evoke myogenic potential, it stimulates SECU. Expected MCQ. SECU. VEMP SECU. For the last 2 years, your Central Institute have a special love for going in the dissection hall, showing cadaveric images, showing specimen. They can show you a specimen of larynx. I will waste my crucial 2 minutes on this image. They can ask you multiple MCQs. Now listen carefully. If the examiner is showing you something at, what is this one? A. I want everybody should reply in the chat box. What is A? Sir, A is epiglottic fold. Yes. Sir, what is B? They can ask you. This is pyriform fossa, covering your larynx from both sides. Pyriform fossa. Is it paraglottic space? No, sir. Paraglottic space, I want MRI. It is not visible here. It is pyriform fossa on both sides. In pyriform fossa, they can ask you the importance of internal laryngeal nerve. They can make an arrow at this point and they will ask you, okay, what is the importance of this area? And there will be an option given, supraglottic examination. Yes, if I give anesthesia here, if I give a block here, I will get a anesthesia in the supraglottic segment. 40-year-old male with a history of fish intake, complaining of loss of sensation in the upper part of larynx where the fish bone stuck in here, which is smuggler fossa, that is pyriform fossa. Or examiner, if I'm your examiner, I will be making a pointer here. What is this one? Any student? What is this? arrow. Now what this arrow is pointing out? What I'm going between base of tongue and epiglottis. I'm going between base of tongue, epiglottis, base of tongue, epiglottis. What I'm showing you, focus. Anyone? Yes, they have asked every structure except this structure in the last 2-3 years. This year they can ask you vallicula. Excellent. Here comes the answer, vallicula. This is your vallicula. So I hope this specimen will help you in the upcoming INICET examination. Yes, very favorite, thumb sign or stipple sign. Thumb sign epiglottitis, stipple sign laryngotracheobronchitis croup, low grade fever, symptomatic treatment. Here I will give IV antibiotics, but always remember, never give painful stimulus to the patient of epiglottitis. Stepto, no controversy over this point. I don't know why few books they are mentioning H influenza, not at all. Success of vaccination awesome in our country. That is stepto. Papillomatosis, 1 MCQ expected. Juvenile papillomatosis multiple, senile are single. Always remember, this is juvenile papillomatosis multiple, they resolve, they reoccur. Senile, they are single, they never resolve. Treatment of choice, CO2 laser, they are pre-malignant. AIIMS people are fond of asking what you will not do in this patient. The Central Institute, now they will not ask you the site, they will not ask you a symptom, they will be asking you the clinical point. So glomus tumor, Ngo Fibroma, never take biopsy. Papillomatosis, never intubate. Clear? Always remember, in this patient we always do tracheostomy if required. A new drug is approved, Cidovofir, which is for papillomatosis. Clear? I'm trying my best to give you, touch all the important topics. What is this? This is a mass on the vocal cord. Glottic carcinomas, highly radiosensitive tumors, supraglottic, subglottic, I will be going for surgery. Glottic, I'll be preferring radiotherapy. Just 1 minute on the treatment for CA larynx. Always remember, carcinoma in situ, we go for CO2 laser. If a MCQ comes from T1 or T2, always remember MCQ from T1 or T2, I will either go for glottic. I have to choose one. I will choose one single modality. Glottic, I will go for radiotherapy. While supraglottic tumors, we prefer HPL, horizontal partial laryngectomy. In hemilarynx tumor, if tumor is on one half of the larynx, we use VPL, vertical partial. And last is, if glottic tumor are radio resistant, I will go for cordectomies. We will go for cordectomy. European classification of cordectomy should be on your tips. Always pray God MCQ should be from T3, T4. Answer, no controversy, only one reply, total laryngectomy followed by radiotherapy. Am I understandable? Total laryngectomy followed by radiotherapy. After surgery, we use rehabilitation. They can show you these 3 options. The first option, this is your Blom-Singer prosthesis. This is your Penji button, and this is your Provox, PROVOX. Beta, इनमें से एक क्वेश्चन आएगा. They can ask you 1 MCQ from vocal rehabilitation coming on the nasal side. What I am showing you in the next 2 to 3 minutes, 1 MCQ will be there. They can either ask you agonizai, the most anterior, the most posterior nodi, a question. Then next MCQ, they can ask you either bulla ethmodalis, they can ask you bulla ethmodalis, they can ask you the halar cell making the floor. Bulla ethmodalis is your largest, halar is your lowermost. But what is there in the nose? This is not any ethmoidal sinus. Where is my marker? Now this marker is somewhere in middle turbinate, but middle turbinate should be radio opaque or radiolucent. In this image I am getting radiolucency, air. Why there's air in the middle turbinate? Because I am showing you the most common pathology which is seen in 70% of the patient. Which pathology I am showing you? Concha billosa. Clear? They can ask you inferior turbinate hypertrophy. They can show you image of inferior turbinate hypertrophy, which is a image of hypertrophic rhinitis. Always remember a rule: below the near the floor, near the palate will be your inferior turbinate. The closest to the palate will be inferior turbinate. Inferior turbinate hypertrophy, mulberry-like nasal mucosa will be there. Mulberry-like polyp will be here. Rhinospodiosis. Here comes the image where I can write confidently. Okay, yeah, this question can be there in INICET on 14th November. Heterogeneous opacity with peanut butter. Next time when you enjoy peanut butter, you should revise a topic: allergic fungal rhinosinusitis. So peanut butter like mucus with heterogeneous opacities, because we are getting fungal elements in the nose, so it will not be homogeneous like this. This is homogeneous what I am showing you, but if you get some fungal elements, it will be heterogeneous. This question expected. Better please revise one classification of allergic fungal sinusitis, that is BENT, bent classification. They can ask you which of the following is a minor component. Fungal culture is a minor component. Expected MCQ. Clear? So please revise in a nice way. Hypertrophy of nose, rhinophyma. Mulberry-like polyp, rhinospodiosis. What is this one? This is your rhinoscleroma. Always remember, foul-smelling nasal discharge with woody nose. This question can be there. Foul-smelling nasal discharge with woody nose is your rhinoscleroma. Which is the organism? Klebsiella is the organism. Drug of choice will be streptomycin, tetracycline, miculicel, Russell bodies. Rhinoscleroma. I am writing few words for rhinoscleroma: miculicel, Russell bodies, Carpenter glue. If you have revised my notes properly, these are the keywords I always share in my lectures: Carpenter glue, tapered nose, or Hebra nose. Out of these 5 words, they will use one to make a diagnosis of rhinoscleroma. Wow, comes the most important classification for Central Institute, Ogden's classification. Which patient? Carcinoma, maxillary sinus. Which patient? Occupation of the patient, sir? Nickel industry. What is below the line, sir? Good prognosis. What is above the line, sir? Brain is there, orbit is there, therefore poor prognosis. So what is Ogden's principle? Ogden's principle is below the line, good prognosis; above the line, poor prognosis. Then what I'm expecting, one MCQ in trauma. In general surgery, they will be asking you this MCQ. This is your Lee-Fort classification. Always remember, if the fracture is at the level of palate, is at the level of floor of the maxillary sinus, this is Lee-Fort 1. If it is at the level of orbit, it is Lee-Fort 3. And between orbit and palate, nasolabial fold, which is known as pyramidal fracture, that is Lee-Fort 2. Clear? Palate Lee-Fort 1, pyramidal Lee-Fort 2, craniofacial disjunction Lee-Fort 3. Anybody who can tell me in which patient you will get maximum CSF rhinorrhea? So I will be getting in 3. Can you get in Lee-Fort 2? Yes, it can be seen in Lee-Fort 2. Which 2 patients CSF rhinorrhea will be there? CSF rhinorrhea will be in Lee-Fort 2 and Lee-Fort 3. But if you want to choose one, it will be Lee-Fort 3. Clear? Very important point. CSF rhinorrhea. Again, remember 2 important segment. What is the most common cause? Most common cause is surgical trauma. Which surgical trauma, sir? Sir, endoscopic trauma. What is the investigation of choice, sir? Electrophoresis. What you see on electrophoresis, sir? Beta 2 transferrin. What is the treatment? Treatment is wait and watch. Appreciate the beauty of the topic. Cause surgical trauma, endoscopic trauma. Treatment, wait and watch. But if patient is not responding, we go for endoscopic repair. Cause endoscopic trauma. Treatment for non-responding CSF rhinorrhea, endoscopic repair. But what is the cutoff marking? 2 weeks. Patient should be going for wait and watch with IV antibiotics for 2 weeks. Very important images for Central Institute. In one patient, I'm giving incision on the anterior surface of sternocleidomastoid, so parapharyngeal abscess. One incision I'm giving on the posterior surface of sternocleidomastoid, so retropharyngeal abscess. Parapharyngeal abscess, retropharyngeal abscess. Parapharyngeal abscess, most common abscess of head and neck. This is most common abscess of head and neck. Pterygoid muscles involved. So your AIIMS people will give you option trismus. They can involve the cranial nerves, which is the keyword for retro. I'm waiting for a response in the chat box. Anybody who will update what is the keyword for? What is the keyword for retropharyngeal abscess? Keyword for retropharyngeal abscess will be localized swelling. Localized swelling on posterior pharyngeal wall. If there is a diffuse swelling, it will be prevertebral abscess. If there is a localized swelling, it will be a retropharyngeal abscess. Retropharyngeal abscess extend up to bifurcation of trachea. It extend up to bifurcation of trachea. But what is the most important concept? Listen carefully, every student. The most important concept for retropharyngeal abscess, everyone, it will push your tonsil medially. Listen carefully. Next 1 minute, very crucial. If the tonsil is pushed medially, I have two options. Either it can be parapharyngeal abscess or it can be peritonsillar abscess. So AIIMS people fond of asking this difference. Parapharyngeal abscess, there will be neck swelling. There will be a neck swelling. Here there will be no neck swelling. There will be no neck swelling. This way we differentiate parapharyngeal abscess from peritonsillar abscess. Tonsil pushed medially with neck swelling is parapharyngeal. Peritonsillar, that is your no neck swelling will be there. Treatment is IND, incision and drainage. Clear? They can ask you what is the other name of peritonsillar abscess. Quinsy. What is the definition of quinsy? That is your capsule and superior constrictor. Between capsule and superior constrictor, the speed at which I am teaching you, this speed is required for next few days if you want a decent rank in upcoming examination. What I am showing you, favorite topic, again favorite segment of Central Institute. They will give you some images on topical block. That is basically MCQ related with rhinoplasties. So just remember, I have 4 options for you. I want everybody should reply in the chat box. A, B, C and D. What is A, what is B, what is C, what is D? Extended matching MCQs, they can ask you 4 options A, B, C, D. Infraorbital, the word itself is telling you is option A, infraorbital. A. What is C? C is on the dorsum of the nose. Can I call it as dorsal block? Yes. Anterior ethmoidal block? Yes. If I give anesthesia over the upper part of nose, this area is infratrochlear, and the D option will be your supraorbital or supratrochlear. Again, revise with me. Above orbit, supraorbital, supratrochlear. The word itself is telling you. Upper part of middle canthus, infratrochlear. On the dorsum of the nose, dorsal block. Below orbit, infraorbital block. So these are the 4 important MCQs related with rhinoplasties topical blocks. They can ask you. Next 1 minute, any query, any point you want to ask me. Last 1 hour, I'm teaching you. You are replying. Any query you want me to ask, you people can inbox me on in the exclusive club. You can drop the message, or you can inbox me on Facebook, Instagram. I will try my best to reply as soon as possible. Whatever strategy you want to discuss with me, how to prepare in the upcoming days, most welcome, beta. You can inbox me the message. But the game is we have to work hard. This slide I'm sharing, beta. No regret in the upcoming days. I couldn't crack good rank in the last NEET examination. Is it possible for me? I'm getting 40,000 rank. Is it possible for me to get rank in the upcoming 5 months? Very, very much possible if you don't waste a single second on last NEET examination. Stop doing dissection of the last NEET result. Last NEET result was a big competition was there because it was a delayed exam. Many batches were there. If you couldn't perform well, the next NEET March 2022 is waiting for you. You will be getting awesome rank, but again, your attitude, your confidence matter a lot. Any query you can ask me. Clear? Nasociliary block will be beta inside in the middle canthus. At the level of middle canthus, we give nasociliary block. Clear? So I hope you must have loved this session. Again, I want a promise from you. Never panic in upcoming days, beta. Relax mind, be confident, cool captain, play like a cool captain, MS Dhoni. Just be confident and hit the upcoming examination. Clear? Thanks a lot for listening to me. We stop at this point. Definitely I will make Dr. Harsh. Definitely I will upload